Meanwhile, UK citizens believe the pandemic has caused greater social inequality. That's according to a new study by the government's independent advisors. The Social Mobility Commission says the survey echoed growing evidence that the most socially disadvantaged had been the hardest hit by the pandemic. Joining me now to discuss that is Dr. Bharat Pankania, who is a senior clinical lecturer at the University of Exeter's Medical School. Thanks so much for being with us. As always, what have you personally seen as a doctor working in public health, where the findings of the Social Mobility Commission were actually expected for you?
Well, it is so clear that when the pandemic started, it was a division of two. So there were people who carried on with their lives as normal. They have homes, they have good internet connections, they have gardens, and they can carry on life and they can carry on earning money. On the other hand, there are the already poor. For them, the stay-at-home message is meaningless and it doesn't apply. They have to go out to work. And when they have to go out to work, their chances of getting exposed and infected are that much greater. And these people are also in lower paid jobs, and therefore they have a greater risk of getting infected. They have poor quality jobs and poor pay, and a lot of them have also lost their jobs, or they are on what we call temporary furlough. Inevitably, some of them will lose their jobs. So the markers on the horizon are many that unfortunately the well-to-do will race ahead and the poor will become poorer.
What could have and what should have been done actually to better help those socially disadvantaged people that you could see they weren't going to be able to cope with the pandemic the way wealthier people would have the advantage of doing?
It takes a brave politician to address this obvious elephant in the room, so to speak, which is the poor people, the Black, Asian, ethnic minority groups, poor pay people are going to be disproportionately affected. And you either make it support them with money. They need money and they need support, and you make that available. Of course, the government has gone a long way towards supporting many of these people, but you also need to make it loud and clear that that support is not temporary. There is a lot of stress and depression because everybody who is in that poverty group fears that when the support goes, what is going to happen to them? And the noises from politicians should be, we won't let you down.
Right. Well, is the UK catching up, or at least trying to catch up now?
No, we're a long way away because the poverty doesn't only fall back upon the SARS-CoV-2 pandemic, but it is a creation of the austerity measures that we had further to the banking crisis. And that austerity measures has created a very large, vulnerable, poor class of people who need long-term support and long-term protection with, we are going to change the taxation system so that you remain supported. We are going to give you better pay rises and support you. We heard only a few days ago that the nurses only got a 1% pay rise. It's those sort of things which will depress and create anxiety amongst the lower paid population.
Bharat Pankania, always great to have you. Thank you so much
Thank you
for taking the time.